The Minister of Health, represented by the National Diabetes and Endocrine Center and Oman Diabetes Association, launched today via video conference the 4th edition of the National Diabetes Mellitus Clinical Management Guidelines under the auspices of His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health. The Minister of Health praised the efforts of the joint teamwork who prepared the manual, stressed at the same time on the importance of activating the manual's guidelines in the treatment of diabetes mellitus.
The National Diabetes Clinical Management Guideline, 4th edition, under the patronage of His Excellency Dr. Ahmed Al-Saidi and Professor Andrew Bolton, the President of International Diabetes Federation. In this guideline, we put the latest management medication, we including the whole spectrum of diabetes management, type 1, type 2, diabetes in pregnancy, diabetes in Ramadan, and diabetes in adolescent. This edition included 2 new sections which focus on diabetes in obesity and diabetes in adolescent, since type 2 diabetes now it's common in children and adolescents.
The national health surveys over the past 3 decades have shown and still an increased prevalence of diabetes mellitus in the Sultanate of Oman. A recent national health survey from 2017 showed that prevalence of diabetes mellitus has increased significantly, rising up to 14.5%, along with increased prevalence of risk factors such as obesity and physical inactivity remaining at high rates. The ministry continues in spending substantial proportion of its budget on chronic disease management, which includes diabetes mellitus and its cardiovascular and renal complications. The increasing financial burden is challenging the sustainability of Oman's healthcare system. Chronic illness such as diabetes, hypertension, ischemic heart diseases, and obesity, and its lifestyle risks such as unhealthy diet, physical inactivity, and increases in tobacco use present the main challenges for the health professionals in the 21st century. Towards integrating and improving the quality of healthcare provided to people with diabetes, the ministry has published first clinical practice guidelines in 1996, followed by the 2nd edition in 2003. This has helped the primary healthcare physicians in providing a good standard of diabetes care. The 3rd edition guideline advanced the treatment protocols and was an addition to the development of patient care. This 4th edition comes with the new chapters on diabetes and obesity and diabetes in adolescent.